Hi, everyone, and welcome to what I think is going to be a really interesting interview, exciting interview with Anne Harris, who is the Managing Director of Pfizer Australia and New Zealand. And we're going to talk about Pfizer's recently launched Reconciliation Action Plan. So thank you for joining me today, Anne.
It's an absolute pleasure. Thank you for having me.
Now, the presentation of the RAP was really impressive. You had the minister, you had the shadow minister, you had your local member of parliament. It was a fantastic stakeholder, cross-section of stakeholders. It was really well done. Tell me, that was the end of what I understand was a pretty long journey in the development of the plan?
Yeah. For us, Pfizer's not taking this step into starting our reconciliation action plans. We're very much at the early stages. We're at the reflect stage. We take this very, very seriously. And I think, and it has taken us a bit of time to even get to this launch of our reflect plan. And it's because we're coming at it from a very sincere desire to authentically step into the space of reconciliation. And we know that you can only go at the pace of trust. And we are trying to do things perhaps differently than how we would normally do things. This is not about project plans and targets and tasks. This is about authentically reconciling. And we recognise that it is not an organisation that reconciles, it's the people within it. And so we have taken some time through this process to really learn, to spend time with, and we're incredibly thankful for the Aboriginal and Torres Strait Islander leaders who have opened themselves up to us to help us to learn, to help us to grow in our understanding and to develop our trust, to be in a position now to finally launch and start our Reflect RAP.
Tell me about some of the aspects of the Reflect RAP.
Yeah, so I guess what we're really trying to do is do it the way that Reconciliation Australia has laid it out. There are reasons why you start with the reflect piece, and that is because we recognise that we're laying the foundations of ensuring that we have a workplace that for future RAPs and future reconciliation initiatives is really solid. So right now, our Reflect RAP is focusing on really the many actions, things like procurement, employment. It's about reviewing what best practice is. It's about evaluating our systems. It's evaluating our processes, setting up relationships and seeking advice on the actual plan. So we have a number of elements within it, but it really starts with ensuring that we have really lent into cultural competence and allyship. So that's really very much what we have been doing as we've led into this RAP, and it's what we want to continue. We want to ensure that our relationships are deep, that the aspect of respect is foundational and is in every element of our organisation, and then moving on to what are those opportunities where we can really look at to ensure that, and one area, of course, for us is to look at health inequality and equity and what we can do specifically in that space.
Do you think that pharmaceutical companies have, and healthcare companies in general, have a greater potential than most others to actually support the urgency in addressing the health inequality? Because the statistics around First Nations health is very, very bad and troubling. And successive governments have tried over several decades to address it. But is there a special expertise that companies like Pfizer can bring to that discussion?
So I think we would say that for real change to happen in addressing health inequality, it's going to take everybody. So definitely the pharmaceutical industry and definitely Pfizer has something to bring to this. And it is beyond simply medicines and vaccines. Health literacy is so critically important. And when you have, over 500 clans, distinct cultural elements, distinct languages, this is incredibly complex. And I think looking at it through a very simple, singular lens is not going to get it done. And I think, a number of times we've seen over generations that, as you said, there's been plenty of action or investment perhaps even in this space, but it hasn't delivered sustainable, real outcomes. And I think that that's where if the pharmaceutical industry or Pfizer wants to step into this space, we have to slow down, and we really do need to build proper relationships and understand this diversity. It's about social determinants. It's not about medicines and vaccines. It is about so much more. And you can come to the party with products. You can come to the party with our expertise that we've developed in terms of education and health literacy and just the resources that we can bring to this. But it has to be done in a sensitive, appropriate way that is coming alongside First Nations peoples in their own self-determination of how they want to address health inequity. So we don't see ourselves leading in this space. We see ourselves, firstly, in this reflect phase, becoming true allies, authentic allies, not just a small group of people within the organisation who wants to do this, but really a broad collection across Pfizer that we all want to do this. So when we come to it, we can do it appropriately. And if we do it alongside, as from an ally perspective, then we are hoping that that will truly deliver sustainable outcomes.
Launched the Reflect Wrap. So what is the step now? What's the next 1 to 2 years look like?
Yeah, so for us, really it has probably, like I said, there's a few deliverables that we are looking at. So cultural competence and allyship is really the first phase. So that is about, and we've already started that. We've done some very broad education across and we're really pleased to see the response that we had within Pfizer. We've already had about 500 people complete a cultural sensitivity and engage in cultural sensitivity education. Our leadership team is heavily involved in this, and a number of other people. So it's really about understanding, but also truth-telling, really understanding what has colonisation meant and what is the impact that still lasts today, and understanding those social health determinants from a First Nations people's perspective. So creating those opportunities for immersion, volunteering is certainly one aspect of it. So community relations is another aspect there for us. So it is about really developing these effective, trusted partnerships with key community leaders. We have really an amazing group of advisors, First Nation advisors, who have come alongside us, and every step of the way we have been checking this. We have been asking for their feedback, asking for their advice, and it's been absolutely invaluable. But we also realise that to do this well, you need deep community relations. It can't be just simply at an institutional level or one or two people. We really need to be having relations that are very networked from top to bottom. And that is something that we will be focusing on, is how do we actually build these community relations? How do we develop the relationships? How do we develop the respect and trust before we can step into it? The other elements I think I've mentioned also, employment strategy is really important for us, as well as our procurement strategy. At this point in time, we are really looking at what does best practice look like? What do our systems and processes look like? So we've recognised that even if we wanted to, we're doing some things around engaging with our procurement strategy with First Nations businesses and graphic design and catering and a number of areas. But we also recognise that as a large pharmaceutical company, our processes and our systems are not always the easiest to engage with if you are a smaller business. So we are certainly looking at that. And we're looking at that not just through our RAP perspective, but we are looking at it from our broader D&I perspective, because this RAP forms part of a very deliberate focus for us on D&I. And our employment strategy as well. That is something that we're looking at benchmarks, we're looking at where we stand now and what would we want to do as we move forward. one of the key things we are looking at is how do we create a workplace that truly is diverse and inclusive, that it represents the community we hope to serve, and that we are providing a space that is culturally safe for people to feel that they can bring their whole selves to work, and it's a place that people want to work and bring themselves to.
And in developing the Reflect Wrap and then planning for the future, is there anything particularly around health literacy that you've been working on?
Yeah, so I think we'll certainly lean into this more as we move forward. But right now, some of the things that we've been looking at is the immediate element of Paxlovid, which is a treatment for COVID-19, and really health literacy around that. And so we spent some time. We would do our normal process, brief an agency, develop materials. We wanted to ensure that these materials were truly accessible to all, and we did engage with our RAP advisors to walk them through what we were planning, to share it with them, to get their perspectives. And it was so critical to understanding how they would perceive it. And again, this idea of health literacy is really very complex at the best of times when you've got, as I said, 500 clans, different people. How do you bring it to a level that is truly accessible to all? And some of the things that we really worked with them was really from an infographics point of view, how can you really bring this down to something that is simple, clear, and truly accessible to many people, that is culturally sensitive? And so we worked very closely with them to develop that. And it did. It had learns along the way. I'll be really honest, with the first draft, some of that language, there was reactions to people that it wasn't culturally sensitive. And I felt that was really important because we learned it was a difficult conversation. And really, this is, how does race fall into, what's race and what's social determinants? Race is not the reason why people have health literacy or have difficulties from the health outcomes. It's the social determinants that we really need to be focusing on. So it was an interesting conversation. It was one where we needed to stop and really listen and learn. And I'm hoping that we not only have a better outcome, but we also have a deeper understanding, and we've built more trust as we've gone along the way.
Well, and it was a very impressive launch, and in that the process you went through was described, and you also got very good people working on it internally, and you brought together those stakeholders. So I just want to congratulate you on that, the journey that you've been on and the journey that you're going to continue to be on. And thank you for sharing that with us today.
Thank you. And I would like to at least say that there've been a lot of people who have helped us on this journey, other people within the pharmaceutical industry who have been further down the path, other people in other industries, as well as our RAP advisors. So again, I want to thank them, and we are very much looking forward to being a true ally and a true partner in reconciliation for the generations.
Thank you, Anne.
Thank you.